G'day, it's the Green Velvet Dragon, and yes, you're wondering, that doesn't look like her, but if you remember from my last videos, I've lost all of my hair due to the gastric bypass, so hence this is one of my numerous substitutions. And it's actually becoming fun. I've got short ones, this bobby thing which I really like, just came last week, and I've got long ones, and I just ordered a really cool anime wig that's white. It's supposed to be really long, like to my knees, so hopefully that will come soon. Anyway, it's almost 2 weeks from my surgery anniversary date, and it's been about 2 or 3 weeks since I've updated, and wow, I'm doing it again, so this is an amazing event. Yeah, many things happen. Many things have happened. Yeah, the ups and downs, gastric bypass, and the latest incarnation is something that apparently not a lot of people think about, and isn't just for people with gastric bypass, but lots of people, especially if you've taken a lot of antibiotics in your life, is what's called candida, or yeast overgrowth. And as I mentioned in one of my other videos, I belong to this group, this Yahoo group called Weight Loss Surgery Gone Wrong. And a lady had mentioned about 3 weeks back that she had massive yeast overgrowth and was taking therapy for it, and then she prattled off a list of symptoms that she had, which really matched what I've been going through. So I started doing some research about it, and it's a completely wild thing. Fatigue, joint pain, your arthritis acts up, your intestines are bad, depression, anxiety, this whole raft of stuff. So if you Google yeast overgrowth, you will find a multitude of websites, some dodgy, some not, but it was pretty amazing. It prattled off this whole list of things that pretty much like ticked almost every one of them. And I've also had like a whole shitload of antibiotics in the last year, especially since I had staph infection in January and February. So I was on massive doses of this really high intensity antibiotic then. And I was on antibiotics actually when I was in hospital for surgery because I kept spiking fevers. And I've been on antibiotics on and off like virtually my whole adult life. So I thought yeast overgrowth was a possibility. Anyway, I stumbled across this thing called the Candida spit test. And if you Google it, you will find it. It's apparently been around for yonks. And it's really kind of gross actually. But you take a glass of water and by the side of your bed, and you have to do it when you wake up in the morning. As I understand it, it has to do with you sitting overnight and your body settling and chemicals and processes and all that happens in your body. But so it has to be first thing in the morning. And what you do before you actually get up is you get a whole lot of spit in your mouth and you into the jar, into the cup of clean water. And you've actually got to watch it, so you need to make sure that it's a clear glass. And according to this, and lots of people, and apparently I've talked to a few people around in the medical community who go, yeah, we try that. If it starts getting legs, like develops legs on it, streams down, and it floats to the bottom, or sinks to the bottom, it means you've got yeast overgrowth. And you're supposed to check it in like the first 15 minutes and then leave it sit for an hour. Well, mine started to sink virtually instantaneously. It grew legs and sunk like a stone. I didn't even have to wait an hour. And so I went to my doctor, and he's used to me telling him weird things, and then he knows that I'm very proactive about my health care and about looking after myself, and since I've been through all this drama with this surgery, and he just kind of goes, oh, okay, well, I've never heard of that, but you have been on a lot of antibiotics, so I think it's worth a try. So he gave me a script for Deflucan, and like 100 milligrams once a day. And I started to go on a yeast-free diet, which is really, really hard. I mean, I'm hardly eating anything as it is, and to even eat no carbs. But what I've decided to do is I've eliminated gluten, which is easy to do, because God knows if you're a celiac, you've got to. I know I have lots of friends who are celiacs. So that's really easy to do. The state needs to make a lot of gluten-free stuff. But getting rid of the sugar was harder. I have to have a certain amount of sugar in my diet, because if not, since I'm no longer technically a diabetic, well, technically I am, but the surgery cured it. But if I don't have a certain amount of sugar in it, I go hypoglycemic and my blood sugar plummets, and almost ended up in diabetic coma. So that's not good. So I do have to have a certain amount of sugar in my diet, and I do that via fruit. And I'm eating actually baby food, though we're not allowed to call it that in my house. We've decided we're calling it jarred fruit, because baby food is weird, and pureed food makes it sound like you're a little old person in hospital. So I'm actually eating like applesauce and fruity pears and this gel stuff, and yeah, I'm just eating mostly fruit in the Heinz baby food line, and it's the right serve, and it gets what I need, and it's tasty, and there you go. So other than that, I'm following the yeast-free diet, and it's been about 2.5 weeks, and the first week was incredible. This thing called yeast die-off happened, and I really thought I was going to die. It felt worse than I felt at my worst with this surgery. Aching all over, and the yeast dying off and just literally coming out of my veins, because it's probably crossed over from the intestinal area. It's probably in my blood by now, they figure. So it was literally just dying off, and it felt like I had the worst case of flu ever. I had such terrible body aches and pains and headache, and and if you Google yeast die-off or candida die-off, you will find out that it is, and it lasts for a few minutes or a few hours, up to a few weeks, and I'm still experiencing some not so pleasant side effects, but it does appear to be working, and the weight is actually even coming off even faster than it was before, especially since I stopped the gluten. That seems to have made a huge difference. I'm actually dropping 1/10 of a kilo a day, which may or may not be a good thing, but I was kind of starting to stagnate for a bit. But I think it is working, and I'm going to take it for a month. I'm not sure if I'm going to take it any longer than that. I'll have a chat to the doc and see, but I think for those of you that have experienced that, and it is, weight gain is part of candida and yeast, and you can have it on your body. When you have it, you have to have candida in your body. You can't get rid of it totally, but you need the good bacteria. So I am replacing it with a really high grade, broad spectrum probiotic called Sinback, I think I got at the health food store. It's really nasty tasting because it's powder, and you mix it with like a tiny bit of water, and I slam it like a shot because you really don't want to taste it. It's pretty wicked. But it does appear to be working, and all the literature, both reputable and dodgy, says that most people stop in the first couple weeks because the yeast die-off is so horrible, that they just don't want to deal with it anymore. But if you can actually stick with it and hang in there and go, it's actually worth the horror, and I'm really hoping that it is worth the horror. Today is like the first day I seem okay. I guess it's been a week and a few days. So anyway, I'll wrap this one up for now, and then I'm going to in the next video talk about, I've had some questions about, I mentioned the carnitine that the medical community wanted me to take, so I'll do that very shortly.